So today I'm going to show you how to use the oxygen tank. Very simple to use the tank. So you want to make sure you have a wrench, which is going to be used to pretty much turn on the tank to allow the oxygen to flow out. As you can see, this is how you use the wrench. So, there's different types of wrench. Some are made out of metal, some are made out of plastic, but they all do the same thing. This right here is your O2 regulator. This lets you control how much oxygen you want to flow into your BVM or your non-rebreather mask or your nasal cannula or whatever is connected to on the bottom part. You're able to adjust it, so you can pretty much regulate how much oxygen you want to come out once this valve is connected to the tank. As you can see, there's special hose here which allows the valve to connect into the tank. So this O2 regulator is used only for oxygen. If you try to take this oxygen regulator and place it on a different tank that is not oxygen, it would not fit. As you can see from these identified markings right here, this allows this O2 regulator to fit on an oxygen tank. All right, so as you can see, very important. If you ever have to put your tank together, look at this area where I'm pushing it back and forth. Then you want to go ahead and twist this part right here. You want to make sure you secure your O2 regulator to your tank. It is extremely important. Secure your O2 regulator to your tank. Extremely important, right? Nice and tight. Make sure that it's secured. This is a tank. All right, as you can see right here, you could actually switch where you could pretty much determine how much oxygen you want to use, especially how much oxygen you want to give to your patient. So the next thing you want to do is, as you can see, just look right there, make sure it's on 0, right, before you turn on your tank. Now go ahead and get your wrench and turn the tank on, right? So you turn it on. You turn it on, the tank is secure. Make sure it's on 0 before you turn this tank on. All right, so once you turn on the tank, you'll see the little arrow where you see the meter. It will actually go up to the green. This tank actually is empty, so it won't go up to the green. So once you actually turn on the tank and it's at the green part, you can set it for 2 liters if you want or whatever you need. This right here is the port, the tubing. Always keep your tank down, all right? Always keep your tank down. I'm doing it again. See, this is the tubing part. Put it into the valve and go ahead and put your tank down. You do not want your oxygen tank to fall. If your oxygen tank falls, it could become a weapon and it could shoot through the wall. So always keep your tank down. This right here is called the bag valve mask, also known as the BVM. As you can see, I'm going to go ahead and connect it, right? So I can have a high flow oxygen for my patient. All right, so it's extremely important. You could connect this tube to and make sure that it's at least on 15 liters per minute. For a patient who's definitely unresponsive and not breathing, you always want to make sure that you have 15 liters per minute on your oxygen tank. All right, so now let's go ahead and set this for 2 liters or 4 liters. So the average rate for using a nasal cannula is anywhere between 1 liters to 6 liters. If you work in a hospital, if you're a new nurse or technician, it's 1 to 6 liters for using the nasal cannula. It's great for EMS providers. It's very important to know. You always want to make sure that, as you can see the prongs, you want to make sure that it's going into the direction of the patient's nose. So if you need to play that back, so go ahead and play it back. So you want to make sure that it's bending into the patient's nose. Once you do that, you want to go ahead and take the tube, of course, the lining, place it around the patient's ear, and then, of course, secure the nasal cannula. Keep in mind and remember, the only liters that you could use for a nasal cannula is 1 to 6 liters per minute. So you have 1, you could use 2, you could use 4, you could use 6. So no more than 6 for the nasal cannula. As you can see, you want to make sure that it's secure around the patient's ears and then tighten it up from the middle just to make sure it doesn't fall. All right, so extremely important to make sure that you turn on the oxygen, have the oxygen going through the tube before actually placing it on the patient. This right here is what we call the non-rebreather mask. The non-rebreather mask, it's usually for a patient who's a little bit more distressed. The non-rebreather mask go on a patient who can breathe by themselves. All right, if they can't breathe by themselves, you're going to use that BVM. But this patient could breathe and they're awake. They're just having a little bit distress and just need assistance with breathing. What you're going to do is you're going to go ahead, place your finger right on top of the valve right here. Once you do this, this will allow the bag to inflate. So like I said, you always want to make sure you turn on the oxygen first. So once you do this, the bag will inflate. So put your finger right there on the top part, right? Now you want to go ahead and place the mask on the patient, all right? So go ahead and put the elastic over the patient's ears, of course. Make sure the patient's comfortable. It does help someone when they're kind of sitting up a little bit to breathe. So it's extremely important that you know that. You could put up the bed a little bit. Of course, this is a non-rebreather mask, all right? I hope all these videos help. If you do have any questions, just feel free to always reach out to us, and that's why we're here for you.